Hello, California. Wish I could be there in that beautiful state, but this gives me the opportunity to show you how we can do physical therapy through telehealth. And that's the question I get all the time. How is it possible to do virtual physical therapy? Well, the secret is simply in the training of the clinician, and I'm going to give you a glimpse into that process. So let's jump right into it and see my first patient who's simply using his smartphone. So Paul, you injured your back at work. Tell me what your symptoms are.
Well, my whole back does hurt all the time, but I do feel a shooting pain down the back of my right leg.
Okay. Is there any positions or movements that bring on that symptom down your right leg?
Like I said, it's always kind of there, but if I do something like bend over, tie my shoe, reach down, pick something up, that's when I really feel it.
The first thing the physical therapist must do is to assure that the patient in front of them has symptoms that are mechanical in nature. For it is not our role to diagnose a tumor, inflammatory disease, or an infection, but it is our role to recognize the difference between mechanical and non-mechanical pain. So Paul, next I want to take a look at your ability to move. What I'm going to have you do first is bend forward like you're going to touch your toes. So go ahead and try to bend forward. And tell me what happens.
I feel pain shooting down the back of my right leg. I can't even get to my knees.
Okay. Now I'm going to have you put your hands on your hips and bend backwards as far as you can go. Great. Any problem or difficulty with that one?
Not really.
And now you're going to turn and face me. And I want you to glide your hips to the right and then the left. Great.
Oh, yeah.
And what
happens?
happens?
I can feel that right there down the back of the leg. I can't go that far to the left.
Okay. So Paul, next we're going to do a series of repeated movements. What I'm going to have you do is go ahead and straighten your arms all the way out. Pressure on, and then come all the way back down, pressure off. Each time I want you to go further, further, further. Pressure on, pressure off. Pressure on, pressure off. Paul, I'm going to have you bend forward again, trying to touch your toes. And I want to know if it feels any different from the time before.
Yeah, it does. I can go farther, and I still feel it in my back a little, but I don't feel it as much down my leg. I don't feel it all down my leg.
Great. Well, sitting there now, tell me about your symptoms. Do you have any symptoms in your back or your leg?
Yeah, I still feel it mostly shooting down the back side of my right leg.
Okay. What I'm going to have you do is I'm going to have you scoot to the edge of that couch. And I want you to sit up nice and tall, bring your shoulders back. Great. And I want to have you put a curve in the small of your back. Okay. In that position there, tell me about your symptoms.
I don't feel it down my leg at all. There's no pain in my leg.
Okay.
Amazing.
So you can see from the slouched sitting posture to sitting up straight changes your symptoms in your leg. When you're slouched, it's kind of like if you have a cut on your knuckle and you bend, it opens up the cut. So when you're sitting slouched, it opens up that cut in the small of your back and it puts pressure on the nerve, causing symptoms to go further down your leg. That's not good. But when we sit up, it's kind of like overpressure. We're putting overpressure in that small cut in the disc, taking the pressure away from that nerve. This is called centralization. This is what I want you to do. So now you're in control of your symptoms. So when you start getting symptoms down your leg, pay attention to what position you are in, because that whatever position causes symptoms down your leg is opening up that cut, allowing that disc to put more pressure on that nerve. But when you change your posture and your symptoms come out of your leg and closer to your back, it's just like applying overpressure, and that will help to speed up the healing process. So to sum it up, how to have a great virtual rehab program. Number 1, early access to the right clinician. 2, your clinicians must be properly trained in how to assess virtually. 3, your clinicians must focus on patient empowerment and fear avoidance behavior, not passive care. And lastly, that one-to-one relationship. It's amazing how deep it develops even through telehealth. We hear from our chronic pain patients that for the first time, someone's really listening to them. So we do not lose that personal connection through telehealth. If anything, it may be made stronger. Thanks for allowing me to be here virtually, and I hope you have a great conference.